Let's conduct the head-to-toe assessment. Let's start from head. Inspect the evenness of growth over the scalp. Inspect hair thickness or thinness. Inspect hair texture and oiliness. Note the presence of infections or infestations by parting the hair in several areas and checking behind ears and along the hairline at the neck. Inspect the amount of body hair. Palpate the presence of the lesions. Palpate the temporal artery and note the rate, rhythm, volume, and symmetry. Auscultate to determine any bruit. Determine the sensory function of the facial nerve by stroking cotton ball into the different areas of the face and do the sharp or dull or sharp or soft test if necessary. Perform the hot or cold test. Palpate the temporary. Ma'am, close your eyes po and tell me what you feel po. Okay po. What do you feel, ma'am?
Soft.
What do you feel po?
Sharp.
Let's assess the eyes. Inspect the eyebrows for hair distribution and alignment and for skin quality and movement. Ma'am, pakitaas po yung kilay nyo. Okay po. Inspect the eyelashes for evenness of distribution and direction of the curl. Ma'am, pikit ka po. Okay na po. Assess the visual acuity by determining the distance and near vision. Okay. Ma'am, pakitakip po yung isang mata niyo. Nababasa niyo po ito? Ano po ito, ma'am?
E.
Sige po, ito po.
F. P. T. O. Z. L. P. E. D. F. E. L. O. P. Z.
Inspect and palpate the lacrimal gland. Pikit ka po. Tapos dito. Tingin ka po sa taas, ma'am. Tapos sa gilid. Okay na. Inspect the cornea for clarity and texture. Ask the client to look straight ahead, hold the pen light at an oblique angle to the eye, and move the light slowly across the corneal surface. Ma'am, tingin ka po dito. Dito lang. Perform the corneal sensitivity test to determine the function of the fifth cranial nerve. Ask the client to keep both eyes open and look straight ahead. Approach from behind and beside the client and lightly touch the cornea with a cotton ball. Ma'am, harap ka lang po ng straight dito and then ay gagawin lang po ako. Assess each pupil's direct and consensual reaction to light and accommodation. Okay, ma'am. Yun ka lang po dito. Assess peripheral visual fields. Ma'am, pakitakpan po yung isang mata niyo. Tapos sabihin niyo po sa akin kung stop na kapag nakikita niyo na po ito. Okay po. Ito. Okay, sa kabila naman po.
Stop.
Assess 6 ocular movements to determine eye alignment and coordination. Ma'am, i-move ko po itong pen light and then susundan po ng mata nyo without moving your head po. Okay. Ito po. Let's proceed to the nose. Inspect the external nose for any deviations in shape, size, or color, and flaring or discharge from the ears. Lightly palpate the external nose to determine any areas of tenderness, masses, and displacements of bone and cartilage. Determine the patency of both nasal cavities. Ask the patient to smell different kinds of scents. Ma'am, i-close niyo po yung eyes niyo, then sabihin niyo po sa akin kung ano yung maamoy. Ano po yung naamoy niyo?
Calamansi. Sour.
Inspect the nasal cavities using a flashlight or a nasal speculum. Observe for the presence of redness, swelling, growths, and discharge. Inspect the nasal septum between the nasal chambers. I-check ko po yung ano. Okay. Palpate and percuss the sinuses. Ma'am, sabihin niyo po sa akin kung masakit. Masakit po?
Hindi.
Masakit po?
Hindi.
Masakit po?
Hindi.
Let's proceed to the ears. Inspect the auricles for color, symmetry of size, and position. Palpate the auricles for texture, elasticity, and areas of tenderness. Perform the voice whisper test. Ma'am, may ibupulong po ako, tapos po sabihin niyo po sa akin kung ano yung gagawin.
11.
Let's proceed to the mouth. But before that, we need to wear gloves to prevent the spread of microorganisms. We need to inspect the outer lips for symmetry of contour, color, and texture. Inspect and palpate the inner lips and buccal mucosa of color, moisture, texture, and presence of lesions. Inspect the teeth and gums while examining the inner lips and buccal mucosa. Inspect the surface of the tongue for position, color, and texture. Ma'am, yung makapo. Inspect the oropharynx for color and texture. Inspect one side at a time to avoid eliciting the gag reflex. To expose one side of the oropharynx, press a tongue blade against the tongue on the same side about halfway back and open the mouth wide. Use a pen light for illumination. If needed, inspect the nostrils for color, discharge, and size. Ma'am, mag-apo kayo. Okay. Elicit the gag reflex by pressing the posterior tongue with a tongue depressor. Mag-apo kayo. Let the patient taste different flavors. Ma'am, may mga ipapatikim po ako sa inyo, tapos sabihin niyo po kung ano yung malalasa.
Maasim.
Tapos ketchup.
Matamis.
Oh. Let's proceed to the neck. Inspect the neck muscles, sternocleidomastoid and trapezius. For abnormal swelling or masses, ask the client to hold her head erect. Ma'am, straight nyo lang po yung head nyo. Observe head movement. Ask the client to move her chin to the chest. Move her head back so that the chin points upward. Napuko. Inspect and determine for the presence of jugular vein distension. Palpate the trachea for lateral deviation. Place your fingertip or thumb on the trachea in the suprasternal notch and move your finger laterally to the left and to the right in spaces bordered by clavicle. The anterior aspect of the sternocleidomastoid muscle and the trachea. Inspect the thyroid gland. Stand in front of the client. Observe the lower half of the neck overlying the thyroid gland for the symmetry and visible masses. Ask the client to hyperextend her head and swallow. If necessary, offer her a glass of water and to make it easier for the client to swallow. Ma'am, inumin niyo po. Tapos tangad po kayo. Let's proceed to thorax and lungs. Assume that this assessment is done privately. Posterior thorax. Inspect the shape and symmetry of the thorax from posterior and lateral views. Inspect the spinal alignment for deformities. The patient thorax is symmetry and the shape is normal and her spinal is in proper alignment. I auscultate the chest using flat disc diaphragm of the stethoscope. Use the systematic zigzag procedure used in percussion. Ask the client to take a slow, deep breath through the mouth. Listen at each point to breathe sounds during a complete inspiration and expiration. Compare findings at each point with the corresponding point on the opposite side of the chest. The patient breath sound is normal while I'm listening to the stethoscope without any signs of abnormalities. Let's proceed to anterior thorax. Inspect breathing patterns. The breathing patterns of the patient is normal. Palpate the anterior chest for the respiratory excursion. The patient anterior chest for respiratory excursion is normal. Palpate for vocal tactile fremitus. The patient vocal fremitus is normal. Percuss for diaphragmatic excursion. I auscultate the chest using flat disc diaphragm of the stethoscope. The patient breath sound is normal while I'm listening to the stethoscope without any signs of abnormalities. Have the client stand from lateral position. Observe the three normal curvatures, cervical, thoracic, and lumbar. To assess for lateral deviation of spinal or scoliosis, observe the standing client from the rear. Have the client bend forward at the waist and observe from behind. The patient curvatures is normal. Palpate the posterior thorax. Palpate the posterior chest for the respiratory excursion. Place the palms of your both hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Ask the client to take a deep breath while you observe the movement of your hands and any lag and any movement. In the patient's posterior chest for respiratory excursion is normal. Palpate the chest for vocal or tactile fremitus. Ask the client to repeat such words as blue moon, 1, 2, 3, or 99. The patient vocal fremitus is normal. Percuss the thorax. Percuss for diaphragmatic excursion. Let's proceed to the heart. Auscultate the heart rate at the point of maximal impulse or PMI. Assess for the presence of murmurs, S3 and S4 sounds. Auscultate other valves. Let's proceed to breast and axilla. Inspect breast size, contour, presence of retraction, etc. The patient breast size contour is normal and without presence of retraction. Do the breast exam accurately. Palpate for lymph nodes enlargement, especially at the tail of Spence. While I'm palpating the patient breast, it has no enlargement of lymph nodes, especially at the tail of Spence. Let's proceed to upper extremity. Do the musculoskeletal assessment. Test for the muscle strength. Ma'am, gayahin niyo po ako. Ganito po. Tapos sa kabila din po. Tapos both po. Assess for sensations to temperature, pain, and touch. Ma'am, sabihin niyo po sa akin kung ano yung mararamdaman.
Malamig. Masakit.
Palpate the radial pulse and report the rate and quality. Let's now proceed to lower extremity. Do the musculoskeletal assessment of the lower extremities. Test for muscle strength. Ma'am, pakigawa po yung leg raise. Assess for sensations to temperature, pain, and touch. Ma'am, pakisabi po kung ano yung mararamdaman.
Malamig. Masakit.
Palpate the pedal pulse and report the rate and quality. Assess for the nails and the capillary refill.
Thank you so much.